Hello, everyone. We have extraordinary guests with us today. We have Bhavya Rehani and Ankur Bharija. And Bhavya is the CEO and president. Ankur is the co-founder and board member of Health for the World. They're both medical doctors based here in the United States, doing a lot of work in the developing world, including in India, where they were both born. This is an amazing story. You don't want to miss this, so stick around.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Bhavya, Ankur, welcome to the show.
Thanks so much, Devin. Thank you for having us.
Thank you. Glad to be here.
Really thrilled to have you both. Thank you for making time. I know you're both busy traveling the world and with your medical practices, but I'm excited to learn more about what you're doing with Health for the World. Bhavya, maybe you could just take a moment and give us a quick introduction, an overview to Health for the World.
Yes, Devin. So Health for the World is a 501c3 nonprofit, and our mission is to promote health in under-resourced settings in the developing world through use of free education and technological solutions. So we are currently working in 22 countries. We started 1 year ago and started from one country and have expanded to 22 countries and have helped about 3,500 people in this last 1 year. The inspiration behind Health for the World was both Ankur and I grew up in India, and my grandparents were in a small village in India and did not have access to health care. And having visited them in high school and having seen them struggle through health problems, I always wondered what the solution is. So we were looking for some sustainable solutions which are not short-term, but which provide long-term relief. And that was the inspiration behind Health for the World.
Ankur, maybe you could give us some specific examples of the educational programs and technologies you're deploying.
Absolutely, Devin. There's web-based and mobile-based platforms that we use for education, both for patients, public, and healthcare providers in any corner of the world, actually. We started off with education around stroke, a disease that affects many, and number 2 leading cause of death globally. And we created a mobile app that can be downloaded both for iOS and Android phones, which is used for education around rehabilitation after stroke, learning how to prevent another stroke, and helps with communication for those who are not able to speak, communicate with their family members. And it has various technologies integrated sort of on the back end, if you will, things like a machine learning chatbot, which is meant to be a conversational companion to remind them to engage with their friends and listen to relaxing music. There's virtual reality-based mind exercises that encourage them to get out of their own limited home environment, virtually, if you will, and encourage them to imagine that they're moving a part of their body, which essentially has science behind it, that if you, along with regular exercises, if you are able to imagine that you're able to move that part of your body, that facilitates rehabilitation. There's 3D animation based exercises which are more attractive to go with them at home, which would encourage them to do exercises in the right manner. So these are some of the technologies when it comes to the mobile app around stroke care and education. And of course, we have our virtual classrooms that we have for education in multiple countries for health providers around the world. And I'm sure Bhavya will like to elaborate on that. So thank you.
Excellent. I noticed that I was kind of prowling your Facebook page, and I noticed you've had some extraordinary medical professionals, doctors participating in trainings. Bhavya, why don't you tell us just a little bit about how that works?
Sure, Devin. So we have been very lucky. We have had leading medical experts from 20 different teaching hospitals from US who have volunteered to teach. And the way that is done is we have a live virtual education, as Ankur was mentioning. And so we have live grand rounds in which the experts from different parts of the country tune in and teach to healthcare professionals in different parts of the world. Like, for example, tomorrow morning, we have a live lecture to a small hospital in a rural setting in Cameroon in Africa. With medical doctors, and we'll have a doctor from Stanford tuning in live to teach the healthcare professionals. And you can feel the passion from both the sides. The doctors are so excited to teach because they know whatever they teach will have a huge impact in that setting. And on the other side, the students are so passionate to learn. And they have, they grab everything, they learn, and they have specific questions which they address, which is specific for their settings. So because we have a huge database, we have been doing this for about a year now, and we have a huge database, and we'll be launching a new website. It's called Health for the World Academy. And it will have lectures from these medical experts in different medical specialties, not just in medicine, but surgery, cardiology, infectious diseases, and everything will be free of cost so that healthcare professionals from different parts of the world can access it. And it is also geared to health, not just doctors, but nurses or community healthcare workers who are in villages and who are trying to help the patients and who are trying to find reliable information about what is the right way to do a medical exam or what is the right way to diagnose a condition. So we are really excited about that.
Boy, I guess that sounds absolutely wonderful. Ankur, you've had, young as you are, an extraordinary career. You had the opportunity to do so much good around the world. What's the accomplishment you're most proud of?
I think we're really proud. One thing for sure is to be able to build something that's of value to patients, healthcare providers in local communities which are far, far away from urban settings like ours. These are generally settings where there is limited access to basic healthcare, and a big gap that we have been able to address by virtue of our programs and services has been knowledge gap. And that knowledge gap, whether it's for patients, their family members, healthcare providers, and in working with our local champions in these sites, we have been able to create something that's of value, is culturally and linguistically sensitive to their needs. And I think we should be really proud of that.
Absolutely. Bhavya, you too have had an extraordinary career. You're doing just amazing work professionally and philanthropically. What's the most important lesson you've learned?
I think the most important lesson is the lesson of teamwork. You know, though it's Ankur and me and Dr. Bill Dillon, who's the co-founder of the organization, the challenge of healthcare is so huge that it is not a task of one or two people. And we have been lucky to have a huge team of doctors and nurses who want to do this, and not just people in medicine, but people in background and technology who want to do this, who have created the app, who are working on the website, people in media, people in the lawyers who are looking at the legal aspect of how to do this in different countries. So just we have people from diverse background, and I have learned that the importance of you can do big things in this world, make a big difference if you have a fully dedicated team who wants to give back, who's driven by the passion of, in India we call it seva, selfless service, who's driven by that passion. And, and that even when you have such a great team, the impact can be so huge. So every day when I work, I'm just inspired by my team members. I really am. it helps me not to get tired, because we have team members full of energy and who want to do this, who want to make an impact, who won't hear a no for an answer, who don't give up, and who really want to bring smiles on the faces of people. So the importance of a really strong, dedicated team is something which I've learned.
Oh, that's wonderful. Ankur, I wonder, you clearly could be satisfied as a medical doctor with the contribution you make to the world. Heaven knows most doctors do. And a few satisfy the urge to give back by traveling with occasionally as a volunteer with an organization like Operation Smile. They'll do a mission trip there with an organization, and then they'll tell their kids about that for 20 years, a 2-week trip. You've really dug deep in this effort, Health for the World. Why?
I think the why really, is something that's actually driven everything behind what we're doing, and I think that is that innate feeling of we can do more, and having seen so much suffering, so much gap in healthcare, and so much disparity. Frankly, in a world that is so flat now, it's so easy to get to anywhere and connect with anyone. There's sort of this burning drive to be able to reach out and provide better resources to those who don't have enough. I think inherently as it goes back to sort of growing up in India and going to medical camps in rural sites, a few hours out of New Delhi or city urban areas, and seeing the needs, seeing the suffering, and just has stuck on, with me and others in our team, and I think that really continues to drive us even today.
Yeah, fascinating. Well, Bhavya, what is your superpower?
My superpower? I think that I don't give up. I keep dreaming, and I keep, doing my best to find solutions for different kinds of problems which arise every day because of the kinds of operations we have in different countries. So I think that has helped me, because the challenges are so big, but just having that faith that we have to find a solution to make this work has helped us, incredibly.
Oh, wonderful. And now, Ankur, before you go, and I appreciate both of you taking the time to be with me this afternoon and with us. It's just a great and important discussion, but I know how busy you are. But before you go, if you would just take 1 minute and tell everyone how they can learn more about Health for the World and perhaps connect with you and Bhavya personally.
Absolutely, Devin. We are, as you've learned, a global community, and very inclusive and diverse. And that's the only way we can keep on moving our mission forward and our work forward. So we would love to hear from anyone, whether it's from medicine, but not just medicine, technology, business, and other specialties and areas who would want to give back, who want to be involved in healthcare, bringing healthcare via technology and other services to different parts of the world. You can go to our website, healthfortheworld.org, and connect with us through there, or just use email contact@healthfortheworld.org. Send us an email. Tell us what's on your mind, and tell us your stories of what you've learned in this work, if you're already doing it, or what you hope to do. And we'd love to learn and we'd love to work together. Thank you.
Wonderful. Well, I want to thank you both for taking the time to be with us today and wish you every success in improving the health of the world.
Thanks so
Thank
much,
you.
Devin. Thank you.
Thank you, Devin.
Alrighty.
Pleasure talking to you.
Let's do some good.
Thank you for listening. Devin Thorpe's mission is to end extreme poverty, improve global health, and mitigate climate change before 2045 by finding and sharing the stories of those who are doing the most good. You can join with other listeners to accelerate Devin's mission by visiting helpdevin.org right now.